Thank you very much for having me present. It's the first time I've joined your group. I'm very honoured to be with such a wide selection of people with so many skills and so many ideas. And I've been really inspired by both those talks to learn, and both about place initiatives and just about that connection. I think it's so important. I apologise for a lack of beautiful slides, and I have no poetry, but I shall be inspired next time to do something similar. Now, I'm going to talk about working with patients and families to identify goals of care. I want to, when I talk about this, I'll give examples from the Irish setting where I work and some examples from Gaza and other places I've set. But I guess what I'm talking about are principles, and we each have our own culture where we interact differently, where phrases are important to us. How we use our language is different in each place, and who is the most important in terms of who is appropriate to talk to, how we talk to people is very much linked to our own community and our own culture. So I guess when I present this discussion, I'm presenting a set of ideas that we will need to take to our own setting and perhaps take aspects that can work and adapt it to make in our own work in our own setting. So I'm going to talk about working with patients and families to identify care goals. I'm just going to see if I can make we may have to ask somebody else to do this because I cannot make this move for some reason. There we go. So I'm going to start talking about goals of care. So, sorry, I'm missing a slide. I'm going to talk about what are goals of care, why are they important, when do we consider goals of care, how do we create realistic goals of care, and then I'm briefly going to show you a couple of tools and framework, and I'm going to try to do this in a very short amount of time because I know we're caught. So my presentation there. So what are goals of care? Well, goals of care, if you look at the dictionary, goals are about aims and purpose. And so when we're talking about goals of care, we're talking about the aims and the purpose of what we do. Well, if you're sitting listening wherever you are, you might think, well, why would I need to talk about this? Surely every piece of healthcare I give has an aim to make a patient better and a purpose to enhance their life. But actually, there's more to goals of care than just that. And it's the bit about collaboration that Andre talked about that we need to think about, and maybe utilising that connection that Anne talked about. So in our context, as we talk today, we're talking about meeting patients and people who have illnesses that are going to shorten their life. And we are coming as healthcare professionals because we know we need aims and goals of care. And we know that you matter, as Cicely Saunders says, to the last moment of your life. And we know that we will do all we can to help you die peacefully, but also to live well until you die. So I'm going to come as a healthcare professional with my physio skills, my nursing skills, my doctor skills, or whichever skill I bring, social work skills. I'm going to assess the patient. I'm going to listen to them. I'm going to identify problems. And then I'm going to offer solutions with the goal of making the patient better, with the goal of helping them live well. But everything I've said here is really the context of the healthcare professional. The healthcare hero. I've not said much about the patient. And one of the challenges when healthcare is provided, I think, in any setting, is that it can be from the perspective of the doctor or the nurse or the other healthcare professional. The perspective or context of the patient may be very different. They've got different values. What's important to them may not be the same as what's important to me. They may they will have lived until they had their illness as a worker, probably, as a mother, as a father, as a carer. And these things are important to them. They might be someone who's known to be very strong and they value that. Or somebody who's very wise and able to talk, or somebody who's very social. So they have values. They live within a culture, as Andre said, and the culture is so important. And their role in that culture is important, but it may also affect what they want to do with the life they have left. They have beliefs about how life should live, beliefs about what it means to be somebody, beliefs about why things happen, and they will affect life going forward. They have experiences. They may have been a carer for someone they may have cared for someone who's ill, or experienced someone else being ill and know that they want to have something like that person experienced, or they definitely do not want to have that kind of experience. Their illness is going to be individual. Maybe they have a sarcoma that's affecting their leg. Maybe they have brain mets and they're a little bit confused. Perhaps they're incontinent. Each person will have their own challenges. And as Andre and Anne recognised, the family and those close to us are really important, not only in our role, but also in our influence as to what we want to do and how it be done. And then our needs are different. We've got social needs, psychological needs. You may have spiritual needs. Why has this happened to me? And so each person has an individual illness and an individual set of goals of care that are experienced, that are sort of occur because of all these different aspects. So I'm going to tell you about a patient because I met a patient just recently in which goals of care, my goals of care and his goals of care were interesting. They were similar, but quite different. So a gentleman came into us. He was 40 plus, but nowhere near 50. And he had an advanced metastatic cancer. He'd only been diagnosed with this very recently. And he'd gone from being somebody who was sporty, who was a father, who was the earner of life, to somebody who was less well in bed, not able to do a lot of things. He came into the hospital where I work because he needed symptom control. And when I first talked to him, his aims were to get better. His aim was to go home. His aim was to be a good father. And his aim was to sort out paperwork and the car, actually, which wasn't working. We treated with the antibiotics and we did a lot of things. But over 10 days, my patient became less well. And I realized as a physician, using all my clinical skills, that my patient was going to die and going to die within a few days. I recognized he wanted to be at home and with his family when he died because he told me that was a goal. So I thought I need to go into him and I need to chat. I need his wife to be there because she's very important. When he wants decisions, he always wants his wife there. And I need to talk about going home, about having no more antibiotics. And I need to talk about not coming into hospital again. But actually, his goals were a little bit different. His goals were that he wanted to write letters for his children for when they were older so they could know his wisdom. He wanted to record his wife so his voice so that he could be heard in the future by his family. And he wanted to be as awake as possible because when he went home, he wanted to be the father. It was all about being a husband, being a father, and maintaining that role as long as possible, and even after he died. So it was really important to him that we acknowledged those goals and that we worked towards them. And actually, both of my goals contributed to his goals, but if I didn't ask him about his goals, I wouldn't really understand, and I wouldn't be able to make a plan of care that was really good and important. So by developing goals with the patient and with the patient's family, we can actually make the patient, we can develop goals together that work together, and they take into account the healthcare workers' goals, but more importantly, they take into account what matters to the patient. And what matters to us is so important. If we acknowledge that and if we work towards it, we saw that goals are about aims and purpose, about meaning. So by listening to our patient and recognizing what's important to him and why it's important, we can support hope and meaning. And then we can plan care that is realistic to their condition, but actually is really still hopeful. And that my gentleman was in Ireland, but similarly I remember meeting a gentleman in Uganda who had bowel obstruction, and my aim was that his tummy was comfortable, and his aim was that he made up with some friends he'd fallen out with. So we made his tummy comfortable so that he could talk, and the social worker bought some small amount of internet and he was able to link with his friends. So it doesn't necessarily need to be complex stuff, but we really need to understand what the patient wants and work together with our goals. So as I said, the goals can be varied. We need to think about social goals. Does somebody is a birthday important? Is a marriage important? Psychologically, my patient wanted to be awake and not drowsy because he wanted to be a father. Some people don't want chemotherapy. Sometimes they're about treatment because they've seen what it does and they actually just want a life where they're not suffering, whereas others want chemotherapy because they value time. So there are lots of different needs that we need to be aware of. So what we're saying is that we have individual patients with individual goals and individual needs. When do we address these goals is one of the questions that my colleagues would ask me. And I think we need to be aware that goals change. When my patient arrived, my 40-year-old man, he had one set of goals, and when his illness changed, in the space of 10 days, his goals changed. So we need to review our goals regularly. So maybe at first point of contact, what does your patient want? What is their interests? If you're planning a change in their care, or when a change occurs in their health or their circumstances, maybe they're old and their wife has died while they're ill. Or perhaps if you've just not talked about it for a long time, if you are in a situation where you look after patients for a longer period of time. So we've talked about goals and we've talked about that they're individual, but how do we actually go about doing this? How do we go about sharing goals and making shared goals together? Well, as we've seen, it's mainly by listening to the patient and the family. We need to be really central and listening to them. We need to clarify, to really understand what they want, not just what their goal is, but why they have that goal. Because sometimes what they want isn't possible. I have a patient at the moment who really wants to walk, but that may not be possible. But actually what she underlying wants to do is socialize. So perhaps I can, using a wheelchair, take her out. We can sit in a cafe and look at the people walking by, and we can satisfy her want and make life meaningful for her. So we need to clarify, reframe, and plan together. So there's some very common steps, and some of them you will know, and I want to keep this swift. So you need to prepare. You need to know the details of your person that you're going to talk to, and consider where you meet and who should be present. So for my patient, his wife was so important, but his children were too young. You need to explain why you're going to meet, and there can be some useful phrases that we can use, but you may find that you need to adapt phrases for your own culture and your own setting. So for example, you may say, can we meet later to discuss your health? Because I want to understand what is important to you, so we can make plans that suit you. So we're preparing the patient for this meeting, and we may need to reassure them that we're not breaking bad news, because when we hold meetings here, patients are often very fearful, as are their relatives. We need to, if we're going to talk about goals and aims, we need to make sure we're starting at the same foundation, that we're starting at the same place. Because when we get set off on a journey, we need to start in the same place. And here we also want to end up in a similar place. So we need to ask the patient about what their understanding of their illness is, what their understanding maybe of the future is. And that may be asking the patient or the family. And then we need to clarify and make sure we start at the same foundation. And then if we're really wanting to know about the goals of the patient, we need to ask what matters to the patient and why. We need to establish what is important for the patient and family, and establish why it's important. And again, there's some phrases that are useful. They're very common sense ones, and you can again adjust them for your own setting. But we know from evidence that is certainly in the UK that patients make goals, but they often don't tell us about them. And the reason they don't tell us about them is because we don't ask. And if we don't know what we are, we can't assist them. So can you tell me what is important? Do you have any plans? And then why? It's important to understand. But often we're inhibited about asking these questions because patients can ask for unrealistic things. I have a patient at the moment, I have two patients who want to walk when that isn't realistic at the moment. And what I need to do therefore is understand what it is they're wanting to do. We had a patient in Uganda once, he had a sarcoma and he wanted to play football. When you dug into that, what he wanted to do was hang out with his friends. And so when he couldn't play football, we needed to look about, could we facilitate meeting and playing with friends? So we clarify goals and meanings. In Gaza recently, we met a patient, and when they were chatting to her, the team realized that her really important thing was that she wanted to cook. When they dug into the meaning, they found that was because she was a mother, and that is how she looked after her family. We need to look and see if these goals are realistic and possible. And one of the questions the team might ask is, do you think this is something you can do at the moment? So by considering goals, we're not only helping hope and helping people to do what matters to them, but we're helping them to adjust to their illness. So with this lady, she recognized she couldn't walk at the moment, she couldn't cook. So if she wasn't strong enough to cook, the team thought with her, and they said, have you any other ideas that you think might work better? Because it's really important that they are part of the process of planning what we do. And they decided to buy food and invited the children, and they shared a meal together, and it really brought joy to the family and to the patient. So we've seen with my patient that his goals change in the space of 10 days. So we need to keep reviewing our patient and adapting the goals, because things will change for them. Their family situation will change. Their families may become tired. They may be scared. Their mobility may change. So things will change. But by constantly being aware of our patient's goals and resetting our goals of care, we can help the patient adjust. And as we've seen, by doing this, we can sustain hope, support, and enable the patient to live by doing very simple things and using our medical skills in a way that they wish to. Finally, there are some tools that you can look at online, and they're in the reference from this slide. There's a REDMAP framework and a REMAP framework. And there are many other frameworks, but these can provide frameworks that you can look at and adapt. And they may help you have these kind of conversations with your patients. And they give you other phrases that I've not talked about that may be helpful to you in your own environment to talk to the patient and their family, or the appropriate people in your setting when setting goals for your patients. So that's my talk. Thank you so much.